disease of problem gambling. But especially if you've legalized it, you got to put some of that money back in. The funding it's a wide range. Of course, Alabama's got nothing, so they're going to need F. Right north of where I live in Maryland, they provide $14,000 a year for the entire 5.6 million people in Maryland. Our Maryland chapter does a lot, but on 14 grand for the entire state, that's tough to do. So again, as advocates for problem gamblers, we've got to be there and say, we're going to speak up for the problem gamblers to say, this cannot pass, this is not sufficient. Where they're, in most cases though, we're fighting, billions with pennies. I mean, it's an uphill battle. But we know this from all addictions. I mean, there's a fraction of tobacco money that goes back into smoking cessation campaigns. But we can use that pretty efficiently and effectively, we believe. As counselors, for those of you that are counselors and those of you that are kind of thinking about this as a public health issue, when we look at things like workforce and the services implications for if we're going to set up, and as we set up a services network here in Alabama, the good news is that this may be less expensive than substance use because you pretty much don't have detox. You've got withdrawal. I mean, there are some guys that get really, guys and girls, they get, that have physical consequences to stop and gamble. But by and large, you're not looking at things like medical detox. Also, we believe that, again, most problem gamblers are probably treated most efficiently in outpatient settings, which you can deliver relatively cost-effectively. And one of the gists of the National Council is that we believe public-private partnerships do work. So I'm going to partner with, I'm not one that believes that the state is going to have to jump in here and all of a sudden set up all sorts of centers across the state and, it's all going to have to be run through a state agency. I believe that private nonprofits such as the Alabama Council, faith communities, for-profit treatment centers can get in here and provide specialized services, reach hard-to-address populations, do culture-specific work in a way that sometimes the state agency can't. The state agency may have a regulatory role, an oversight role, certainly perhaps a funding role, but that I believe is private, private agencies can do a very good job, and in many states do a job. But there's got to be that partnership there. And it's not necessarily just public, not necessarily the state and the council, but it's all the stakeholders getting together. Unfortunately, the current model, like in Maryland, I mean, it's all nice, it's all well and good to talk about the stakeholders getting together. But if you're getting together around a table with $14,000 on it for the whole state, that's good, but there's a lot more that we can do. So, unfortunately, for those of you that are well versed in the public health model, you know that the curve goes like this, where the least number of people that have the worst problems cost the most money. And those are pathological gamblers. But from an ethical perspective, you can't not treat them just because they cost a lot of money and are going to consume most of your time and energy and services. We know it's most efficient and effective to go way over here and provide prevention services for the 100% of people so that you have fewer pathological gamblers. We know that even if you go down the curve a little bit, you just educate the 65% of Alabamans that are going to gamble this year. If you deliver them some prevention messages, you're going to hopefully decrease the number of people that will fall into gambling problems. Or people that are gambling problematically, maybe they get that educational message and they get some help and they end up never developing a problem. However, again, with the limited resources we have to sort of by default orient towards those who are in the most severe, have the most severe problems right now. Roger talked about the winning phase, the losing phase, and the desperation phase, and that's where most of our interventions sort of by definition occur now. We're in essence, and especially in Alabama, we're waiting for the problem to get so bad, so horrible, so unsolvable, that you find the National Council. Because the number's not really promoted anywhere. Since we don't have a chapter yet that's doing this public awareness, since, if you go to Victory Land, there's no brochures up, there's no one, encouraging you to call their number. We're literally waiting until people hit bottom. And most of them are just hitting bottom on their own, and there's not too many good choices when you're there. A few have kind of clawed themselves over by their bootstraps. And we don't know, literally, we think it's about 108,000 people in Alabama who meet criteria for gambling problems, but to my knowledge, there's never been a prevalence survey. And we're talking about things like adding on gambling questions to existing surveys that are already there. You know, if you're asking about drugs, tobacco, sex, alcohol, rock and roll, add on the gambling questions. You know, it's not that hard.
The other thing too is when folks are down at that far end and they bottom out and, you know, heavy duty pathological gambler, he or she has lost their job, lost health insurance, and when they can afford it, the least they need it the most.
Exactly. Yeah, that's a great point. I don't know if y'all heard that, but yeah, when they need it the most, they can afford it the least. Sorry.
I feel all the crisis calls are coming to the state office. We get people all the time calling for gambling addiction programs and have no number to give them.
Right.
So, you know, they're left out there still searching, but we get calls all the time for people who are seeking help for gambling addiction. Yeah,
and we can help provide some of that safety net. You know, because that's kind of our job as the advocates in states where there are no chapters. You know, we'll try and step in as we.
Well, I got your number.
Yeah, I mean, we'll talk further because you know the fact of the matter is there is not much of a safety net. Yes.
Do you already have screening tools in place that you provide?
We do. There's a number of online resources that Roger and I are going to put together, either in CD form or set up a website. There's even a 2-question screen, the live bet screen. There's some real brief intervention stuff. There's a lot of things online that I can get you, or through the Addiction Technology Transfer Centers. There's a number of, we actually were in the unique position of donating, think about this, a nonprofit like ours, we donated materials to the federal government because they had so little. Now the federal government is not necessarily hurt for money right now. But we actually had to donate materials to them so that they had some problem gambling materials. But they put it online at least, and so you guys can all access it for free. So yeah, we'll help construct. We'll get you everything we can get you, free, no cost, low cost, because we're still in that triage model as well. But eventually, as we mainstream this with other public health and mental health and behavioral health issues, I think we can do this stuff a lot better. Oh yes, I'm sorry. The good question, does insurance pay for gambling? I don't want to discourage you for those of you that are counselors, from submitting reimbursement. When we've surveyed nationally certified gambling counselors, so those people at a master's level and have gone through 2,000 hours of counseling, 80% of them were refused routine reimbursement for a diagnosis of pathological gambling. A lot of it depends on who you are and who your insurance company is. We can't get the insurance companies to tell us whether or not they're going to cover it. They say, well, are you a policyholder? No. Click. We don't think it's going to be impacted by healthcare reform nor by parity reform. Pathological gambling wasn't specifically included, but it's not specifically excluded. But what our providers tell us is that by and large, run-of-the-mill average counselors have about an 80% failure rate. If you're a board-certified psychiatrist, you might be able to do it in. So what ends up happening, one of the reasons it's this kind of a hidden disorder, is that a lot of people that are desperate, and this is not necessarily ethical or advised, but a lot of people bill it under depression, or they bill it under substance abuse or co-occurring disorder. So, but there's that great feedback loop. Because people aren't submitting, because people aren't getting reimbursed, it doesn't show up. Because it doesn't show up, it's not seen as a problem. And so we've got this great loop. But to answer your question, I mean, it's never certain, but many insurers don't routinely reimburse, which again makes it very difficult to get these folks out. But the good news is, there's some free stuff available that we'll get you to, and what we'd like to talk to you in the next session is the specific steps that we can take, you can take with your friends and colleagues and family to help make sure that there are services available, to make sure that we can start together, even in this room, right here, we can start to knit together a safety net, that doesn't exist right now. This is a preventable and treatable disorder, and if there's one thing we know from almost 38 years of working with this population, there is hope and help, and that's if there's anything I can leave you with, is in spite of all the statistics and how gambling's changed, the essential fundamental truth is that while this is a disease, like most diseases, it is something that we can do something about. So we'll take a quick break and then we'll come back and